Hello, everybody. Welcome. I see folks are joining. We'll get started in 1 minute. All right, so we're going to get started. Welcome. Good afternoon, everybody. Welcome to today's important discussion, which is part of the Low Dose Aspirin Initiative's webinar series led by CMQCC in partnership with March of Dimes. So just a couple of technical notes before we get started. So during this webinar, your camera and microphone will be turned off. However, we encourage you to ask questions using the Zoom Q&A feature. We will have time at the end of the webinar for the panelists to answer some of your questions. And if you are interested in the continuing education credit hour, you must be in attendance for 50 minutes, and you will receive an evaluation survey at the end of the webinar. And just note, this is being recorded and will be available after for viewing on CMQCC's website. So my name is Dr. Lindsay Plessis. I am the Community Engagement Lead at CMQCC, and it is my privilege to be your moderator today. We are here to explore the critical role that doulas play in supporting healthy pregnancies, particularly in preventing complications like preeclampsia and related preterm birth, and transforming the lives of moms, birthing people, and babies in California. So this webinar is part of an impactful CMQCC initiative in which we are bringing the expertise and resources that have traditionally served hospitals into the outpatient world. It is one of a kind in its approach, bridging the gap between hospital-centered care and the everyday experiences of women and birthing people in their communities. And doulas, as we know, are an integral part of this journey. So today's panel will explore the vital role that doulas play in creating safe, supportive environments for pregnant people, providing information, comfort, and advocacy at every stage of pregnancy. We will touch on how doulas can teach about the risks of preeclampsia, the importance of preventive measures like low-dose aspirin, and also how doulas support can improve outcomes for families across our state. We're incredibly fortunate to have a distinguished panel of experts with us today who will share their knowledge on everything from the training doulas receive to the specific impact they have on maternal and infant health. Our panelists represent the heart of this work, and we are so excited to hear their insights. So before we dive into the discussion, I want to thank CMQCC and March of Dimes for their continued commitment to improving maternal health outcomes and for making this conversation possible. So without further ado, our panelists will introduce themselves and we will jump right into the discussion. So first, I'd like to start it off with Kairis.
Good morning. I am excited to be here amongst my fellow passionate maternal health care advocates. I am born and raised in Oakland, so I am a Bay Area native serving in the Sacramento region. I am a doula and doula trainer. I began training doulas with the original Birthing Project USA in 2001. I am more recently a founder of an affiliate project called Children of the Sun Doula Project, where we focus on training doulas, parenting, and more than anything, taking care of the birth workers so that there isn't burnout. I also get to call myself pastor, community health advocate, peer support specialist. I'm an ambassador for the city of Sacramento, and there are tons of other things that I do, and those are what I do. But who I am is a Black cowgirl with strong ties to East Africa, thanks to my husband and dual citizenship in Kenya. And I am a mom of 7 who range from age 13 to 33.
Welcome. Thank you so much, Kairis. Nkemka.
Hello, everyone. My name is Nkemka. I am the Program and Navigation Services Manager at Roots Community Health. I started my journey as a doula back in 2022, and I am the manager of our doula program, and so I support my doulas by not just having the training and being there as as a person that can step in, but I just I'm I'm there for them. I'm there for them and the community. So I support in other programs as well. I'm also a mother of two babies, one in heaven, and then also my daughter that is about to be 2 this month, and and trying to think. Oh, sorry. And I have my MPH, so I have my master's in public health, and I focus on maternal and child health. So that's me.
Thanks, Nkemka. Michelle.
Hello, good afternoon, everyone. I am Michelle Sanders. I'm a full spectrum doula, lactation educator, childbirth educator, and I'm also a surgical technologist. I'm the founder of Beauty for Ashes Maternal Wellness, which is a nonprofit organization where we focus on many things. So, in addition to direct service, providing families with free doula support, we also focus on workforce development and sustainability. So, helping folks become doulas and then helping doulas actually get paid so they can remain in the work. And I am a Los Angeles native, born and raised in South Los Angeles. That is where my practice is based. And this year, we launched the Birth Equity Consortium Doula Hub in View Park, Windsor Hills, and it is a place where doulas can come and get all the support that they need. And I'm very happy to be here today. Thank you.
Thank you, Michelle. Kamilah.
Hi, everybody. Good afternoon. My name is Kamilah Davis. I am the PEI coordinator, the Perinatal Equity Initiative program coordinator in Santa Clara County here in the South Bay area in California. I am trained in social work, so I have my master's in social work, but really enjoying my role here in public health and just all things public health, and I've been in this role for 4 years. I am also a certified peer support specialist with a focus in maternal mental health. I'm also doula trained, although in this capacity, it just, in my perinatal equity initiative coordinator role. And I also have lived experience with preeclampsia, specifically also HELP syndrome, and as a NICU mom. So happy to be here.
Thank you, everybody. All right. So I know this is going to be a rich discussion. So let's get started. So I'd first like to start with a discussion about the role and the footprint of doulas in California. So the first question is, what role does state legislation, like California's doula Medicaid coverage as an example, play in shaping the doula footprint in California? And Kairis, I'd like to start with you.
Well, thank you. So of course, when there's legislation, there's laws passed, and it's the state job to have their governor sign off on the law, and then they create it and the implementation of it. And so that is what happened with SB 65. But I will also say that in the state of California, DHCS went beyond that. Department of Healthcare Services went beyond that. They actually have spent the last 2, almost 3 years in conversations with birth doulas with decades of experience so that they could, and we could in conjunction with them, co-design a doula benefit under Medi-Cal that would be successful. Everything has its learning curve, but our state has set a precedent for speaking to the folks who actually do the work in order to design the work. To make it equitable. They listened when we said, this is nice, but we need more for it to be sustainable, both for the members of Medi-Cal benefits and for the doulas that we are working so hard to move into the space as providers. So it has legitimized birth work as a solution for our maternal health crisis in this state. And it has stood in the gap between community doulas, professional doulas, all of the range of doulas, and the other organizations who typically have all of the say-so in birth spaces. And I just really appreciate being here at this time and in this season with the state of California really being a leader in how this can be implemented.
Wonderful, thank you. Michelle.
Yes, thank you. So of course, everything that Kairis said. And then, just to see how the Medi-Cal benefit in particular increase access to doula support, right? So you have a lot of folks who thought that they could never have a doula because of financial barriers, not even understanding how to access or where to access doulas. And with this Medi-Cal doula benefit, we have seen access increase greatly. But also a need for more doulas because we have to meet the demand. And so that is why we at Beauty for Ashes focus on training, workforce development, and then sustainability. And also just understanding that, the AIM Doula program that launched in 2019 was a program for Black birthing people. And the Medi-Cal doula benefit, when it came up, we started talking about how to make sure that people understood that, we have doulas from all cultures, from all walks of life, and making sure that, the footprint or the representation was just as diverse as our state. So training not just Black doulas, not just BIPOC doulas, but all the folks to serve all the people across California.
Thank you, Michelle. Nkemka?
To share and just loved hearing everything that Michelle and Kairis was sharing earlier. With ours, we received a grant from the state to start our program. And so it was before we really started hearing about the doula benefits, in California, which I'm so glad that everyone is starting to catch up to the need of the community. And so being able to stand here and say, we're all working together, and different hospitals are reaching out to make this available to everyone. And so I've seen the benefit of being in the room as a doula, and there's so many women that need the same thing. So I'm just glad that there's access for more women across California.
And then Kamilah.
Yeah, definitely in agreement with all that's been said. I just want to piggyback off something Michelle said. Making the great thing about this benefit is that doulas are now accessible to folks that previously might not have been able to afford one. But I also just want to acknowledge that community doula work has been happening still, and that another great benefit of the benefit is that the folks that otherwise were serving their community for free or maybe bartering services are able to be paid a decent wage through Medicaid reimbursement or Medi-Cal reimbursement. Of course, there's still barriers, and the state, I think, is, as Kairis had said, working with our stakeholders to really make it as accessible to the doulas as is to the beneficiaries. So I just wanted to note that as well, that it's folks that and I also want to shout out some organizations in the Bay Area that are working really hard to kind of grow the doula workforce to serve the Medi-Cal benefit, such as Black Women Birthing Justice, also Roots of Labor Birth Collective, and really working to get our Black women trained up to serve other Black women through the Medi-Cal benefit.
Thank you so much, Kamilah. All right, so now I'd like to, really talk about the role of the doula. And I've said this many times before. I had my daughter at 41, my miracle baby, and I knew nothing about a doula, had never heard of it. And that's unfortunate. I wish I had a doula, side by side with me on my pregnancy journey. So I'd really like everyone to talk about what is the role of a doula and what are some misconceptions associated with the role of a doula. And I'd like to start with Michelle.
Okay, so first and foremost, I want to start by saying doulas and midwives are not the same, right? So a lot of people think that we are, and it's very important to make sure that that's clear because our roles are different, right? There are some overlaps, but our roles are different. We complement each other, and we are working towards the same goal. But as doulas, we are non-medical providers. Like we know the medical stuff, but we're not medical providers, right? Whereas midwives are, right? They're clinicians, they're medical providers. And, as a doula, I always say first and foremost, we are educators. So our role is to make sure that the folks that we are serving have all of the information, right? So that's the risks, the benefits, the alternatives, all the things for all the things that will come their way during this pregnancy journey. And we're advocates. We advocate for our clients, but first and foremost, I promote self-advocacy, right? Because I won't always be there. And so helping folks like find their voice, know how to use their voice, know which questions to ask, and then even how helping them to decipher information, right? Because we don't all speak medical jargon. Some of us do, but a lot of folks don't. And so things just are not making sense sometimes. And it's not a lack of education. It's just that they're not medical professionals. They haven't taken medical terminology. And so sometimes sitting with the doula can make things clearer so that folks can truly give informed consent about their care and the care of their babies. And, we also show up as part of the village. It depends on, how people present. But, sometimes we come in and we are like that best friend or that sister or that mother or that cousin or that aunt, but we become a part of folks' families. And, we're in a very intimate space with people, whether it's a home birth, birth center, or a hospital. But we build, really strong, like lasting relationships with these families that we serve.
Thank you, Michelle. I love that you say that you promote advocacy and really that safe space for many of these birthing people. Kairis.
I love Michelle. I just want to say that. The core competencies of birth work trainings are pretty consistent across the board. There's physiologic birth, there are comfort measures, there are positions, there are an understanding of the medications that over time change, but that are typically offered, the reasons for those, the risks, how you mitigate those risks, how you support your clients being compliant with their care based on what their providers are suggesting, helping them understand lab results. Why is it important to know whether urine is proteins are spilling, right? So those things are consistent pretty much across the board. The additional elements of trainings that may not be the first thing people think of are the cultural aspects. It is much easier to speak to someone in the language that they speak. And by language, I could mean culture, I could mean experience, I could mean literal tongues, different languages that people speak other than English, but also the language of, as Michelle mentioned, medical terminology. There is also this bridge role between communities, between the medical provider community and the community that the person comes from. And so for doulas, because we have many more hours with our clients, we get to know them as a person more so than a patient. And so a doula has the ability, the responsibility, and the inclination to recognize when something else is off. It might not be a medical thing that's wrong, but it can lead to a medical thing going wrong. So we're looking at mental health. We're looking at physical needs, basic needs being met. We're looking at the fact that often when you encounter pregnancy in a person of color, the medical world doesn't necessarily greet that from a place of joy. And we have the opportunity and the ability to do that. We're excited with whatever baby, whatever body is bringing forward, and we're going to be there and we're going to clap and cheer and support. And so because of that, we are able to leverage relationship as healthcare. And that is often the critical difference in the care that someone hears about versus the care that they practice.
Thank you so much. I'd like to get to Nkemka next and then followed by Kamilah.
So the role of a doula for us is that sister friend, and everyone is shared. So I'm just kind of, adding on to it. But that sister friend that helps you get over the hump, because birth is hard, and however it looks, being able to we welcome it, C-sections. We welcome all the different variations of how we bring our baby to this life, or to this side, whether it, whatever the outcome is. We're here as the doula, but we build this relationship with the mother. We really try to make sure that they feel seen, heard, loved, in how it looks for her. Like, we really speak kind of that language of like, hey, we're here for you. And then we help you get over that hump of when you feel like you can't do it. Yes, you can. I've been in the room where the mom's, just sits there and says like, I can't do it. I'm not made for this. And I'm here as the doula, like, hold on. Your body was made for this. Being able to encourage them, being able to cheer for them, being able to feel like it can help them to get over that hump. So we really push the mothers on our program to believe in themselves and what their body can do, because a lot of times with pain you forget. And so the doula is there to remind you that you can do this. Your body was made for this. And a lot of the misconceptions, because we are a free service, is that a lot because they feel like we're a part of the family, they were like, oh, can you watch my kids? Oh, can you are you my, can you be my therapist for the session? And we do soft therapy, because doulas do get to be in that intimate space with them, and so they feel really comfortable with sharing. But we aren't therapists. We aren't licensed therapists, and we're also not babysitters, but we do help you help you with navigating through having multiple children. We also, we're not medical professionals. And so that's one of like the biggest, misconceptions. But we do help to support and advocate and to help them to believe in themselves in this transition. So we're the cheerleaders.
Thank you so much. So in the interest of time, I'd like to move us along. There's so much to cover. And so now I'd like to focus on doula training and education. And I'd like everybody to speak about this. And so I'd like for you to just walk us through the general components of doula training, what skills and knowledge are taught during certification programs. And I know that they're all different, so would really appreciate everybody's point of view. So let's start with Michelle.
Okay, so doula training, that is my jam. Yeah, so I love training doulas. So back when I was a surg tech, I was also a surg tech instructor. So like I have that background of education. Why it took me so long to start training doulas, I don't know. But I absolutely love training doulas. But what I learned over this almost 27 years of me being in this work is that there were some gaps in like traditional doula trainings. And so our training was developed to fill those gaps, right? A lot of times people took a weekend training, and that's a lot of information overload for a weekend. And then they come out of that training not necessarily feeling prepared to support families. And so we don't want to cause harm to the families that we serve, and we don't want to cause harm to the doulas that are trying to serve the families. And so, we start from the beginning, anatomy and physiology. Our doulas basically get a childbirth education course, right? There's some lactation training, We talk a lot about self-care to try to manage and prevent burnout. And then we even get into like the business part of it. How do you actually run a successful doula practice? There is some medical terminology in the training because we have to know these things. And for us in particular at Beauty for Ashes, mentorship is very, very heavy because the didactic part is, it is what it is, but you're not going to know until you are actually in that room with that client, serving as their doula. Even if you've had multiple children yourself or supported family members, when you're in the role of a doula, you're showing up differently. Teaching people how to communicate without using words, teaching people how to, advocate or, promote self-advocacy. And also teaching doulas how to engage with medical staff in a way that is beneficial for our clients. Because again, we're all working towards the same goal, right? And so there's a history of tension between medical providers and doulas, and we're trying to mitigate that because it doesn't help anyone. And a lot of times, it's just a lack of understanding. So we talk about all that good stuff in doula training and hope that we are producing doulas that are prepared to do the work and in it for the long haul.
Nkemka, sorry about that. I think I was on mute. Nkemka, would you mind going next? Thank you.
Yeah. So in the training that we receive, so we go through Sisters in Loss training, and through that program, we go through birth, bereavement, postpartum. And so we focus on fertility, prenatal, pregnancy, birth support, as well as medical birth support. We also go through the non-medical, terms and how we can support our moms during birth. And then we have a section on lactation support, but we also supplement that training with another training through San Diego State. They have we have all of our doulas become lactation education counselors. And so they also go through another 10-week training on top of the training that they receive with the doula courses. We also go through postpartum in the doula course and postpartum emotional health and mental health. And we also have all of our doulas go through the maternal mental health through another huge organization, PSI. And so we make sure that they're fully supported in being able to, handle whatever situation. And through that, they also have to do the experience of being going to 3 births and, all of that. So, yeah.
Kairis.
Well, as many things as they have said, it is almost impossible to cover all of the things, like to write it down on a list. But one of the important parts of a training that you'll find for community-based doulas is really just triage for their own personal traumas, right? Because we are, as women of color, our own clients, and often you can come into a space and see a client experiencing something that you've already been through. So learning to check your baggage at the door as a professional, but also working through those things. We work on understanding the risks and complications of birth. We work on how to connect with the families of the birthing people. They don't know me from Adam. So for me to show up on that day and somebody's worried that their auntie can't come to their birth because the stranger is in this space, we have those conversations. How do you become an asset to the family that the family recognizes, all in support of the birthing person? We also teach how to keep the care client-centered and just hold space for the client's birth. We don't speak for our birthing families, but we definitely hold space for them to speak for themselves, even if it's something as simple as a question as, is this what you want, right? Reminding the care providers that this person is driving their own care. With those family connections, we work on boundaries. with our own families, with our own lives, with our own selves, and not overcommitting, not burning out, not being at that risk, and managing our own home lives, because I have children. And when I became a doula, I was a single mom. And so my community really had to step in. So even just building that community, these are all tenets of birth work trainings from a community perspective. And so these aren't things you're going to find in a training manual, but you will find these in the training hearts of those of us who have organizations that are really committed to building up the workforce in a way that makes sense for California's population.
Thank you so much. So, this is part of our LDA webinar series. And so I really want to get into a conversation about doulas being a safe space for birthing people and really being able to enhance low-dose aspirin use. And so low-dose aspirin is an evidence-based prevention approach to reduce preeclampsia and associated preterm birth among those at risk for preeclampsia. And so sometimes there may be pregnant people that tend to seek out doula services to promote a more natural and holistic approach, which can be associated with medication hesitancy. So given that pregnant people often engage with doulas later on in pregnancy, during which LDA adherence is important to prevention of preeclampsia, I'd like to know, or for you all to speak about, how can doulas support a pregnant person's values and autonomy in the setting of medication hesitancy as related to low-dose aspirin use? And I'd like to start with Nkemka.
So how we can support our birthing people is by helping them to understand that there's research. There's been research that has been done, and that we're not just, this is not just another pill to add to your regimen, but this is something that will that even though you don't see the benefit of it now, or maybe you may not see the benefit of it now, at the end of your pregnancy, you will see that your outcome will be different because of this decision that you made. I know for myself, when I heard about the research and how important it was for, as a Black woman, to know that I can take control of my health by just doing this one little thing, it made a difference in my pregnancy. And so I didn't have preeclampsia when I gave birth, but I do have friends that have, had different outcomes because they didn't know. It's the lack of not knowing, or someone not being a part of, someone not sharing that there is research and that there's evidence that shows that just taking this one little step makes a difference, because they didn't know, they didn't, they had different outcomes. But I mean, being able to create awareness is what we're here to do, so.
Thank you, Nkemka. Kamilah.
That's a really good question. Yeah, I think what is also really important is, like Nkemka touched on, related to the research, analyzing the risks and benefits and alternatives of any medical intervention, or any intervention period, low-dose aspirin included. Because some alternatives might be doing no medication, or increasing your protein intake, ensuring that you're getting good cardiovascular activity by keeping active throughout your pregnancy. But like Nkemka said, the evidence behind low-dose aspirin, that there's up to like a 20% prevention rate, is something that I think clients should know. And so that they, with all things considered, can make a decision that they feel good about and informed about.
Michelle, and then we'll get to Kairis.
So when it comes to supporting clients, whether it be low dose aspirin or any other recommendation, I try to help them understand, like, it's about being proactive instead of reactive. And so if there are, like, multiple risk factors, then we talk about, why this thing could absolutely change your outcome. And again, it's evidence-based, like this is what the research says. And so for me, I feel like, for us as, healthcare or birth workers, having folks trust us helps when it comes to relaying this information that, the provider may have relayed to them, but maybe in a different way. And so the way that we deliver the information, the setting in which we are delivering this information, and then the trust that is built between us and these clients can help them either agree to take the low dose aspirin or adhere to what the doctor is recommending for them, and really help change their outcomes. And as doulas, we hear a lot about how doulas really do improve birth outcomes. And so it's not like, this magic dust that we sprinkle or anything like that. It is about us sharing this information and helping people take charge of their health. That's how we improve birth outcomes.
Kairis.
Well, first, I do want to throw out there that everyone who has a doula isn't crunchy granola. And in fact, people who have higher risks of pregnancy outcomes or less than ideal pregnancy situations need that support even more so. Someone who has an understanding, who can navigate those medical systems, who can help them figure out what questions they want to ask at an appointment, can show up at an appointment, right? Remember when you were in school and when the parent came in, everybody was on their best behavior, the kid whose mama it was and the teacher. So it's the same when you come in with somebody who is already prepared with information. And so for me personally, I start with the vision. What do you imagine will happen the day your baby is born? And if your vision is that your baby comes home with you full term and healthy, then it lends itself to the decisions that you make during that pregnancy. The people want holistic, people want as natural as possible. And the most natural thing for a mother is to protect herself and her baby. And sometimes that means medicine, right? And so you can have these conversations with your clients. Everything in pregnancy is not yes or no, it's yes and. So you look at what your risks are, you understand what it is that's happening. If a client understands that the same blood running through their veins is running through their baby's veins, they're more likely to make sure that that blood is in good shape. And even without knowing all of the technical ins and outs, even just supporting the proactive self-advocacy, if you do have a history of these things in your family, and your doctor hasn't suggested this, like even going in and asking about that up front as early as you can. So one of the things that, and it may seem counterintuitive, but one of the things that helps us as doulas help clients receive information and make great decisions is validating the distrust, right? Speaking to it, acknowledging that it's particularly for people of color in this country, there is a history that we are wary of anything that someone on the other side of a medical license is offering. And so when we can validate that and then say, yes, and this is how we mitigate the risk. We ask the questions, we learn the research, we understand what our own lab tests are. How many people have peed in a cup and never asked why or what the results were from it, right? But if your clients understand what that is, they're looking for it, right? Like, I saw that little stick thing turn purple. What does that mean? Or purple means this. And so when a person is empowered to be their own advocate, there are very few things that are reasonable that they will refuse to integrate into their care during their pregnancy.
Thank you so much. These are really powerful statements, and I really appreciate, you all really, on this discussion, this panel discussion. This is really important information that folks need to hear. And so I mentioned safe space, that keeps popping up among a lot of folks. And so let's take maybe about 5 minutes to talk about what does safe space, and you all have mentioned some things, but what does safe space mean in the context of doula support, and how does this manifest during labor and birth? And you mentioned, you all are, you know, trusted sources and you provide that social support. But I just wanted to see if there's anything else that you wanted to touch on about that. So anybody just, you know, come off camera and speak to that.
I think part of being a trusted source it really is that familial connection. For the most part, all through the state over the last few years, there have been lots and lots of doula pilots, right? Lots of people putting funding out to create the data that supports birth workers as a viable and necessary element in prenatal maternity care, maternal health. And one of the things that I found is that all of the mechanisms for referrals are less successful with other communities. Our community tends to trust ourselves. And so if your sister told you about a doula and introduced you to one or connected you to one, there's already a level of trust there because this came from someone that you know, somebody who cares about you. And I think that the referral, the warm referral makes a huge difference in doulas being a trusted source. And then the part where you offer information and it is confirmed in the medical setting versus being the first time that the person hears about it in the medical setting. And that just gives validity. That just gives the ability for the client to say, okay, this person knows what they're talking about and they have my best interest at heart and they've been where I'm going.
I think it's also important to mention like lived experiences or shared lived experiences. So again, we are, you know, doulaing in the communities that we're from. And so, you know, we might share those lived experiences with some of these families that we're serving, whereas their providers may not, you know, their providers, their OBs may not look like them, right? And sometimes there's just like intimidation just going in to see a doctor. There's anxiety. And so people are less likely to share things that, you know, probably would be helpful for their provider to know. And so sometimes, you know, we're the person, the doula is the person who gets stuff that, you know, this pregnant person didn't share with anyone else. And then sometimes, you know, we're the person who can pick up on those subtle cues, that body language. I tell clients a lot where when they're saying, well, I felt rushed, right? When they went in to see their provider. And I said, you know, it's really usually not the fault of the provider. It's just the way the medical system is here in, you know, Western medicine in the United States. And so they don't have the time to sit with you as long as they might like to, but your doula does. And so over the course of us sitting and talking to folks, like all types of things come up that they didn't even know was necessarily relevant to this experience, but you know, they feel safe to share with us, you know, all the ins and outs, the ups and downs, like, you know, things in their family history, you know, mental health challenges, you know, whether they're having like some food insecurities, intimate partner violence, all types of things that they might try to keep hidden from their provider. And so, you know, folks feel safe to come to us. And so it is our job, again, as doulas, to be prepared to help, you know, have resources for that warm handoff for things that are out of our scope, but, you know, the things that get handed to us, and so that we can make connections for people. So again, they can get the best care and have the best outcomes.
Thank you. Nkemka, we have about a minute and then I'd like to get into the questions in the chat.
Yes, yeah. I just wanted to add on because everything that they have shared was just so beautiful. And I wanted to add on that in creating the safe space, the mom or the birthing person feels heard, like you feel heard and seen. I know that the numbers are out there. As a Black woman, we have we're 4 to 5 times more likely to, you know, have a poor birth outcome where we might die or the baby might die. And there's coming in with all of that knowledge and knowing that there's so many risks to just being a Black woman in the birthing space. But when you have someone that sees you and says, I'm here on your team, and that I'm here to support you, and we coming out here. I mean, we're gonna be on the other side. I feel like that creates that safe space because you feel like somebody is cheering me on, as you know, as I'm about to give birth, or you know, as the mom or the pregnant person feels like they don't have anybody on their side because everybody's concentrated on the babies, you know, on the baby and everything else, you know, trying to figure out, you know, other life things, but you have one person there that helps you to feel seen and heard. I feel like that is, you create that intimate, safe space with the mom, and that just changes the whole atmosphere.
Thank you so much. Kamilah, did you want to mention anything?
Yeah, I just using low-dose aspirin as an example, and kind of touching on what Michelle and others have touched on, the fact that in this system is not designed for visits that are long enough to really get to know the person and be able to explain things thoroughly, among other things. So in public health, we hear about people who are should be counseled and eligible for counseling from their provider for low-dose aspirin, but the counseling is inadequate. So moms will walk away saying, well, my doctor said that I should take aspirin because I'm Black and it's my first baby, or because I'm Black and my BMI is high, or because I'm over 35. But specifically for that risk category of Blackness, I think a wonderful space that a doula could fill would be to say, I'm sorry that that wasn't adequately explained to you. It is not your Blackness, it is not your African ancestry that makes you more likely to experience these outcomes related to preeclampsia and preterm birth. It is the system that we live in, the system that practices anti-Black racism. And so because we experience chronic stress due to racism and inequity over a lifetime, our rates of this are higher. And Blackness is really just the proxy for racism. So I feel like that is a space that doulas could definitely kind of, as others have shared, bridge some of that that information or fill in the gaps where there are.
Thank you so much. All right, so I'd like to get to the questions in the chat. So I'll just ask the question and then just jump in. Feel free to answer as soon as I finish reading that question. So we have one. What recommendations does the panel have for improving collaboration and partnerships between doulas, hospitals, and clinical providers so more families can have access to doulas during pregnancy and birth?
Okay, so I've been working on something. My wheels are turning. I know that was Mashariki's question. So we can talk about it later offline, Mashariki. But so I have this vision about, you know, because I straddle the fence. I worked in the OR and I'm a doula in the community. But I love bringing community together outside of like this birthing space, right? And so what that looks like is us having I remember when we would have in-services in the hospital and things like that. But, you know, bringing healthcare providers, OBs together with doulas in our community. Like we have events and things all the time, and it's doulas, it's the families we serve, but we don't very often get any OBs or nurses besides the nurses who are also doulas in our network, right? And so just, you know, giving opportunities for us to interact and engage outside of this labor and this birth, because when that's going on, that's the focus. But we need to be able to engage and like build relationships outside of there, because it is really beautiful when I go into a hospital and there's a provider that I know from outside of the hospital. The result is a client that no matter what the birth outcome, they just feel like, oh my gosh, this is such a beautiful space to be in. And it's because there's mutual respect, there's mutual you know, learning and collaboration and engagement, and the clients can feel that. And so we just need to get to know each other better, understand each other better. And I really think that that would just help a whole lot.
I believe it will also require a paradigm shift. Birth support, pregnancy support is a right and not something that needs to be approved or disapproved third party. And I think when we, as a state, what we're working toward is client-centered care, where all of the members of the provider team are encircled around the member who's receiving the benefit. And so we can all see each other. And it's almost like a dance of who's in closest and who's back. I think that when doulas and other community-based providers are seen just as necessary as the licensed practitioners, that will go a long way. I think that the idea of having to prove your value one client at a time is kind of antiquated. Like, we've been around a long time and we've been doing good work a long time. And March of Dimes is here and making this space possible because they see the outcomes, they see the difference, they have the statistics. And so once we make that shift, I would say even morally make that shift, it will go a long way.
I'll jump in really quickly, and just in addition to all the wonderful things that have been said, making sure that hospital policy aligns with and is welcoming of doulas. So there was a document that went out recently, I think with some of the health plans in the Southern California, about kind of how to address the role of doulas and, integrating them into the birth team. So some things like a major thing is, not counting doulas as visitors. And that's something that's beginning to happen more and more now. Also, having staff go to trainings, not only the implicit bias trainings that are required here in the state of California for birthing hospitals, but also trainings about the role and benefits of a doula and how they really should be integrated as members of the care team that the evidence shows time and time again improve birth outcomes. So yeah, I would add that.
Oh, I didn't share earlier, but I am in Santa Clara County, and I have I'm a part of a CAB that is led by Kamilah and her team, and they also are our funders, and so we get to have this beautiful space where we go to meetings, and we're there in CAB meetings and working group meetings. So we get to build this relationship with the hospitals. And whenever we have events or we have, doctors can send me, referrals directly. Like, this is the beauty of working in a community that supports what is going, like the doula work supports the community that they serve. And so being able to have people like Kamilah that helps to bridge that gap, and between the hospitals and doulas and just everything in between, it's beautiful that we can see that in Santa Clara County. Living it out. So yeah.
Thank you so much. All right, we have about 7 more minutes. So briefly touch on, here's a great question. Can you discuss how FQHCs can implement and incorporate doula support programs?
I'll jump in quickly. I feel like, and this point is brought up about, so one of the barriers, talking about FQHCs in the state of California, is Medi-Cal billing and all the administrative burdens that come with being a doula providing services to Medi-Cal beneficiaries. So I don't work for an FQHC. I work for our local health department, but I do envision, and I'd love feedback on this too from the audience or anyone, a scenario in which you can enlist doulas, have a doula program, bill for Medi-Cal, and also provide that hub of support for billing, through the FQHC's billing team, administrative team, since you're already billing for Medi-Cal. And then just also related to that, I think one source of success that some have found in navigating some of those challenges is doing things as a collective. I want to shout out Caitlin Black too. She was on our panel and had and touched on this too, and just really the power of collective efforts when it comes to community doulas and navigating some of those administrative billing challenges together, whether pooling money or just, kind of like doing it together.
Wonderful. Anybody else, or we'll move on?
Yeah, just for me, I think it's important to connect with the folks that are already doing the work. So in my experience, I've got a lot of folks who are like, can you come and consult and help us build a doula program, but they really don't have the capacity to have their own doula program. But there's no need to reinvent the wheel, right? Because we have doula organizations, community-based organizations. So partnering with those organizations in your community, right? So the FQHC has, they're in this community, partner with these organizations in that community that are already doing the work. And that way, more of the money also can go to the doulas instead of the admins, because it takes a lot to build a doula program and people have to run it. But if the programs are already running over here, it's very easy to connect with those organizations and get your folks connected to doulas.
In that same vein, in those spaces, there are those of us who are out here literally helping doulas cross the provider line one by one. And a lot of the conversations that we had from the beginning was the fact that there needs to be structural support. You can't put the entire burden of maternal health on doulas. And so if you're going to ask us to do these things that are life-saving measures, creating the workforce, supporting the workforce, and then being the workforce, right? As a doula, you're already on call 24/7, and there are organizations that have staff, have departments. We are sole providers. Many of us, community doulas, have private practices. And so even just stepping forward to say, hey, I will hold this task for these community doulas to be able to do what they do and not do the job a second time, writing it down, and doing the job a third time with all the building and billing, and doing the job a fourth time with, their taxes and this income structural thing, right? There are entities out there that have the ability to make this a lighter lift for community-based doulas. And we know that that's the only way we're going to have enough providers to meet the need of all of the thousands of births that happen in our state every year.
Wonderful. So I'd like to combine two questions together, just in the interest of time. So what do you think about doulas accompanying a mother or birthing person to at least one prenatal visit to meet the provider prior to delivery? And then I'm going to add this additional one. Would you please address how doulas can get involved in prenatal period, and how long they can stay involved postpartum, and how can nurses support doulas and encourage patients to work with a doula?
It's standard care. Typically, if there is a need, for sure, we go. For a lot of doulas, that's a part of one of those prenatal visits. We do prenatal visits. Medi-Cal knows that there are a minimum of up to 9 prenatal visits, and that's just if things are going well. As far as the nurses and other folks helping, you have to ask yourself, what happens if the client has an issue on day 43, right? When we're outside of the postpartum period, what happens that whole first year? The risk isn't just a baby coming out of somebody's bottom side. The risk is the pregnancy. The risk is the birth. The risk is the postpartum, and then the post-birth period. So we tend to stay and are fighting and have fought for legislation that allows all of these wraparound services to stay connected to clients for a year. That is in my private practice, and that is in the Medi-Cal doula benefit, that anybody has access to a doula being covered 1 year after the end of the pregnancy, no matter how the pregnancy ended.
Roots. So Roots, we have our doulas, but our doulas are also maternal health navigators. And so they assist with prenatal. They go to at least 3 home visits, and some of those visits might be something that the birthing person might say, hey, can you come to this visit with me? And we would allow our, the doulas can come, or the doulas can go to those visits. And so we can incorporate that into, or we incorporate that into the support of our birthing people. And so we also, that's also about the building the relationship at the beginning. So we really help with the prenatal support, and then we also help with postpartum. And with Roots, we also have a family first program. And so we can stay with the family up until the child is 6. And so we have this continuum of care that we provide support for the women in our program, that not just doula work, but maternal health navigation and family support. And so we can be with a family up to 6 years. And so we really try to support as best as we can, as Roots is as here just to support the community. So
Thank you. And I know we are at time. There's so many questions and we could go on and on about this. But we will make sure to get in touch with those folks and answer those questions. And please note that we will continue to do things such as this panel discussion. It is needed. It's been a long time coming, and I'm just so glad we were able to have this happen before the break. And so I just want to thank the panelists. Thank you so much for your time, for your expertise, for the work that you do, for birthing people and for babies. And so the webinar, you will be able to see this. It has been recorded and we will be in touch. And I just wish everybody a safe and happy holiday season. Thank you so much.
Thank you.
Thank you.
thank you so much.